The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Good morning and welcome to Project Independence and You right here at WCWP.org, 88.1 FM on your radio. And WCWP Radio if you want to download the app. And that works really well for this show. Today's show looks like it's going to be great. My name again is Rebecca Miller and I'm guest hosting today along with Otto Loos, who is the permanent co-host of Project Independence in You. And of course, Christina Liu, who is the incredible radio show producer. And our guest today is Jennifer Cona. And Jennifer is chair of the Board of Trustees of the Long Island Alzheimer's and Dementia Center, LIAD. So we're going to be hearing a lot about LIAD, we'll get some background on it, and then also talk about what's happening during the pandemic. How are we servicing people that normally would just, either come to the center, or have a different kind of contact. So I'm sure there's a lot of information there that Jennifer will provide. So I thought, Jennifer, if it's okay with you, that we would just start out, if you could give us a little bit of a background on LIAD, which is the Long Island Alzheimer's and Dementia Center.
Sure. Good morning. Thanks for having me. It's a pleasure to be with you. So LIAD has been around for 30 years, and the mission of the organization is to make a life worth living for people with Alzheimer's and dementia. And we are the only organization on Long Island that provides hands-on care for people suffering with Alzheimer's and dementia and support services for caregivers. So we're really proud of the services that we provide. And we have a beautiful center now in Westbury. We were for many, many years located in Port Washington, and we had a fabulous dedicated following of people and their loved ones. But we really wanted to expand the amount of people that we could reach and services we could provide. So 2 years ago, we moved to Westbury so that we could reach our tentacles out much, much further and bring more people into our beautiful center. And we also have a respite care program where we have our social workers, our licensed clinical social workers, go into people's homes to give caregivers a break. So we will take care of their loved one in the home and allow caregivers to get out to take care of their needs, such as go to their doctor appointments, grocery shopping, or take their own mental health break, whatever they need to do. And that is such a valuable service that if you are caring for someone who has Alzheimer's or dementia, you would know what an invaluable service that is. So that's sort of a quick overview of what we do. And as to our center in Westbury, when we moved there, it was an opportunity for us to satisfy all of our wish list needs and what we really, really needed. And that was done with the help of an architect who specializes in Alzheimer's and dementia care and in the healthcare industry, and feedback from our participants and our family members as to what would be great for their loved ones. So we have a state-of-the-art center where we have different program rooms for early stage, moderate stage, and late stage. And we have a recreation center. We have what we call sort of a calm room center, where if someone is kind of maybe a little overloaded or just needs a break or needs a quiet room alone or with their caregiver, they can go in there. We have intake rooms, we have support group rooms, we have absolutely everything. And it's all laid out in a way that we keep our participants moving along so that they're getting some physical activity and they're getting constant stimulation. So that's keeping their minds engaged. We have individualized programming, such as music and memory, where we're tailoring programs for them. We have entertainment every single day. So all of this was such a great opportunity when we did move to, like I said, have this wish list incredible center that we're so, so proud of, which is amazing. And then 2 years into this, we're hit with COVID.
Right.
So
Right.
that brings us to sort of present day, what's happening now.
So, with Project Independence, we serve seniors and we have all kinds of programs. We also have social workers and nurses who do community social work and nursing. We have fitness programs, in-person classes. We have advisory committees. We have all of these programs for seniors. And so I know when, it was kind of like everything stops and it's kind of, shocking at first. What are we going to do with all these, seniors, a lot in need. And, we were able to kind of go to Zoom. We have a North Hempstead television station, so we're able to do a lot of virtual programming, and it seemed to really work well for us. Social workers, of course, and nurses are making calls and check-ins and continue their relationship with, the seniors that they talk to. We have this great 311 call center where we get calls in and we can constantly be in contact. So, at first it was shocking, how are we going to maintain, how are we going to service, how are we going to continue Project Independence? And it just kind of happened, with technology and social media and Zoom and the phone. We were really able to, just continue in a different way. So I'm curious because it seems like so much of what you do, the in-person connection is so important. You have such dynamic programs at LIAD. How did you guys adjust and what was that like in the very beginning?
It was like the bottom fell out of our world in the very beginning, in all honesty. And, truthfully, when it first happened, we wondered really, was this a 2-week situation? I mean, None of us really knew what was going to happen. And we kind of just shut everything down and said, okay, let's sit tight for a couple of weeks and see what's going to happen. And that was kind of the approach that I think a lot of businesses and nonprofits took because this was novel for everybody. And then after that sort of initial shock, we said, okay, what are we going to do now? We weren't technology based. That's the sort of exact opposite. Like you said, we were completely all about the hands-on care and the personal touch and all of that kind of thing. So we had to completely retool what we were doing. And that didn't necessarily happen overnight. We really had to rethink everything we were doing and think about how can we bring the level, the quality of everything that we were doing and pivot into something that we can still do, because not only is there still the need, there started to be a greater need, because now you have people who are isolated. And that is absolutely the worst thing for somebody with Alzheimer's or dementia. The isolation, it has caused so many of our participants to go downhill. And it has caused people who were just showing signs and symptoms of early Alzheimer's or dementia to escalate that condition. So it has just been so detrimental to this population. And we have seen such a greater need for our services at a time when we were struggling with how are we going to serve our population. So it was really just the worst of all case scenarios. So we had many, many late nights about this, as you can imagine, to figure out how we were going to start to provide services. So, of course, that's our job. Pivot, right? So we did. And we started providing live stream FaceTime services, video chats, Zoom rooms, and we started creating. First, we rolled out what we could as soon as we could, and then we were able to start tailoring programs, making them more specific. We brought in certified trainers to do yoga by Zoom and FaceTime and all of that. We brought in a certified kickboxing instructor to provide those services, because it is really important to keep people up and moving. We brought in a certified meditation instructor for caregivers. So, we started pretty quickly offering all of these things online. And then we had to figure out, how are we going to start to sort of package the services to make them accessible to people, especially for caregivers, to provide them for their loved one so that they can be there, because the caregiver still has to be there now in the home.
Right.
To offer them, tailor them for what's going to make sense for their loved one. And, so we were trying to figure out the best way to make it accessible and easy for everybody. And the biggest challenge that we really had was getting the respite care for the caregiver, because
right, I can't imagine how that happens.
That was really the hardest part, because the whole, a big focus of what we do is getting that respite for the caregiver. But under this model, the caregiver really couldn't leave the home. So if your loved one is on the computer screen doing, whatever programs they chose for the day, the caregiver really can't most likely go out and take care of their own needs. So if you bring your loved one to LIAD, you can go to work. That's right. A large part of what we're offering. You can go continue on with the things you need to do, but not so when your loved one is in the home. So that was really a hard part of this for us. But one of the ways we are filling that gap is that we have a really incredible counseling service now. So the social workers are now accredited through Medicare and through other insurances, so that we can provide individual counseling, family counseling for people who need it. And a lot of our caregivers need therapy. They need family therapy. They need, individual therapy, and we can offer that now. So that came in at a really, really critical time for our organization, because there's more and more of a mental health need for everybody, but especially for caregivers at this time.
It has to be brutal to be isolated in a house with somebody who you love and care for, going through the whole process of the dementia / Alzheimer's. I just can't imagine how terrible it could be. It could be awful. I mean, it's bad enough under normal conditions, and to throw in this isolation of COVID, it's really hard to imagine how tough that has to be. It's
really, in my opinion, it's much more difficult on the caregiver than the person suffering with the disease themselves.
I agree.
Because you're really pretty helpless. You are struggling yourself, and there's not, there's so much that you're struggling with, and you want to do so much to help, but a lot of our caregivers say to us they feel powerless, and that's a really bad place to be. Lack of control.
Probably some caregivers are not technically up to speed either. So we're talking here, making an assumption that they're sharp on using a computer or a tablet or whatever, but there's probably a lot of people in that boat who are not up to speed, and it's even worse.
We have to take a quick break, so Otto, when we come back, we can address all that, and I have some further questions too. So we will be right back with Jennifer Cona, who is the Chair of Board of Trustees at Long Island Alzheimer's and Dementia Center.
Project Independence is the Aging in Place initiative of the town of North Hempstead. One of the many services we offer is help at home with minor home maintenance. Call 311 or 869-6311 to get more information or receive services.
And welcome back to Project Independence and You here at WCWP.org and 88.1 FM on your radio. My name is Rebecca Miller, and I will be guest hosting the radio show this morning. We have been speaking with Jennifer Cona, who is Chair of the Board of Trustees at the Long Island Alzheimer's and Dementia Center. And before we took break, I know, Otto, you were bringing up a point that you wanted to kind of continue on.
Well, my opinion, and as you know, is that technology is here to stay. And it's very important for seniors to accept that as a fact and try to do whatever they can to get over any hurdles to address that, to do something about it. And the situation that we're talking about, being a caregiver in a home with a loved one who has Alzheimer's or any form of dementia, even makes that even more magnified. And I was just curious, does LIAD provide any support as far as that goes? Like if people are not up to speed with technology, do they try to help them get up to speed? Because like Project Independence does that. They try to teach people Zoom, and that's making an assumption that you have a device that's capable of doing Zoom. So you go back to the real basics. But I was just curious, how deep does LIAD get in that?
We've tried to help people. It's a little bit outside of our resource ability because we only have so many resources we can allocate to that. But so that's why we've offered different platforms, FaceTime, the video chats, Zoom, so that people, if they're familiar with one over the other, they can choose what how they avail themselves of our services. But to your point, I mean, that is a really big deal. And I know in my firm, in Cona Elder Law, we will bring in and do programming for seniors to teach them the basics, whether that is how to use FaceTime, how to use your iPhone, how to stay connected with grandchildren, if that's what they want to do, because we do have to stay on top of it. And just speaking for myself, I know there's so many things I can't do, but luckily I still have one kid left in my house right now. But when she goes off to college in the fall, what am I going to do? I mean, I'm always afraid for that already because, it's a constantly evolving thing and we can't be left behind, to your point. So we do all need to keep up with it because there are so many things that we do need to take advantage of for all of these things. And if we're going to be good caregivers for loved ones, or we want to do things for ourselves, we have to be constantly connected to technology. And we need programs like what you are offering so that we can stay on top of it. And the further behind that you fall, the harder it's going to be to catch up. So we are always trying to tell people in the community, the caregivers, the seniors, at least stay on top of the basics so that you can use your devices for basic needs, continue to be able to do those things, whether it is Zoom or FaceTime or things like that, so that you are availing yourselves of the things that are out there and reach out for programming, if you aren't staying on top of it. It's so, so important. And I do think that people are hearing that message, but they're fundamentally afraid of technology and afraid of change. And it is a scary thing. It's like a lot of people are afraid of things like bill paying online and they want to write checks. It's just that mentality. And I myself have fallen into that too. So we need a little more education to get people more comfortable about these kinds of issues.
I agree. You have to have the mentality that, first of all, you want to learn it, that you're not fighting it, that you think it's going to go away and you like the way you used to do it, writing the check out or whatever. You really have to get past that. And maybe not everybody will. And frankly, that's not always an age factor either. I know younger people that are not nuts about technology and they don't engage it as much as they should. And when they get older, they're going to have a problem.
Right. So I think like there is almost the silver lining of this pandemic, just like we talk about a lot, like even when there was Sandy, all that we learned during that storm and that we were able to carry on with going forward in terms of planning. So, I mean, this kind of forced technology in order to service seniors. There was just no real other way because we couldn't have personal contact with them. And I know with Project Independence, we certainly learned a lot. I mean, we are able to, we have this North Hempstead television where we now can air programs on our government channel. And we're getting calls from seniors who, for the first time, are connecting with Project Independence because maybe they're isolated, a little bit more isolated to begin with and don't get out as much. But now they're able to see, like we have this wonderful Fun Day Monday program in the summer and they were able to be part of it. We have fitness classes. We have all these things. And we've had a lot of requests almost daily when people say, I hope when this is all over, you're going to continue with these programs. So in a lot of ways, even with LIAD, you guys can probably reach people who do have difficulty getting out, that are home and being cared for at home. So in a way, I mean, it's a kind of awful way to get to where we are, but we were kind of forced there. And now we have, another medium, another vehicle to connect to seniors. So that's been our silver lining, because we are going to be doing in-person things and also a lot of the virtual stuff once this is all over.
Absolutely. And same for LIAD. Now that we have the virtual programming, we recognize that we're always going to be able to offer hybrid programming so that people can choose how and where and when they get their services. Because, in the populations that we're serving, it's quite often that someone can't come to our center. They are ill, they can't get out, it's cold, it's slippery, it's whatever, even though we have transportation door to door with trained people on the bus to help everybody. Sometimes it's a comfort level thing. And maybe someone doesn't want to come to the center this week, this day, or whatever. Now they can avail themselves of the services at home. So it's absolutely here to stay. And that is a silver lining. You don't have to go without on that day. It is a silver lining. I believe in silver linings across the board.
Jennifer, you mentioned earlier something that the LIAD does is family counseling.
Yes.
And to me, we've had the unfortunate pleasure of having a family member with Alzheimer's, and it becomes a family affair, whether you like it or not.
Yep.
It is. And just thinking about the technology part of it again, every member of the family could now partake, even if you live in Michigan or wherever. You can have some people at the center. Maybe not right now, of course, but if that would have come back, which it will, but the technology part of it would enable those who might be sort of left out, if you will, of the support that's required, frankly, to get through things like this.
Absolutely. That's another fantastic silver lining, which I absolutely love, because you don't have to, or let's say you have a family member here now who's taking part in family counseling, and they move away, or a child goes to college or whatever, they can still participate same as they were when they were here. It's such a wonderful thing. I'm so pleased about some of those things, because they are more than a silver lining. They're just a brilliant way that we can now conduct our lives that is so meaningful and profound for families or individuals to keep that going. It's a game changer.
It strikes me all the time that in some backward way, the early stage part of this thing is the hardest part. And I don't know, I'll give you my thinking on that, all right? Okay. First of all, you may not have an open communication with the person who you love and care for, who's having the problem. Mm-hmm. And all of the family may not accept the fact that this is really what's going on. Mm-hmm. What kind of, like, the early stages part of it, what does LIAD do as far as that goes? Like, I know you had, I read on your website, consultations. Are those consultations for people who are family members, caregivers, rather than the person who's actually has the problem?
Yeah, that is such a great point. So that's, we've struggled with that a little bit as an organization in terms of people resisting coming into the center because they're saying, well, I don't have Alzheimer's or dementia. And we considered, do we want to name ourselves something different? And well, we can't, because this is what we do, but we get some pushback sometimes. So what we have now, and what we've had for some time now, is what's called, Meetup Tuesdays or Meetup Thursdays. And that's just basically for people who are in early stages, very early stages, or maybe not even. Let's say they're just sort of forgetful. Frankly, my husband falls in this category. So people who their family members are saying, maybe my loved one is exhibiting some signs. To your point, maybe other family members say, you know what, I don't really think so, because a lot of times there is discord in the family. There could be people who are in denial. We see that a ton. And usually that has more to do with historical emotional issues of themselves or their family relationships. But it's a very, very complicated thing. So these Meetup Tuesdays are for them to come into the center. It's more of a social networking with other people. really couched as having nothing really to do with the disease. And it's just a social thing. It's sort of dipping your toe in and meeting some other people. And it's a great way to start. And for some reason, we are able to get people in for that. And it's much, much less intimidating and scary. And it's an entree in, and they can learn what other people, it's like a discussion group. How is this going for you? And what are you seeing here for yourself? And this and that. And they hear the exact same stories from other people just like them. And now they've got that comfort factor of being, we all like to be with people going through the same thing we are, right? Then we don't feel so isolated and odd and what's happening. It's very, very comforting. And now they feel that they can avail themselves of whatever additional services we have to offer. That's been very, very successful in getting over that emotional hump or that resistance. So that's been really great for us.
Do doctors get involved with that at all? Like maybe referring people?
Oh, absolutely. Doctors are our biggest referral source because they are, whether that's gerontologists or neurologists, geriatricians, it could be primary care physicians, because they are seeing their patients, and often they are their long-term patients. Either they're getting diagnosed or they're just hearing these issues, and then they will make the referrals to us.
To me, that's a hard part. And I read not long ago, they're talking about a blood test that might help diagnose Alzheimer's.
I'd love to speak to that after the break.
That would be good.
Yeah. So we'll address that as soon as we come back. You've been listening to Project Independence and You at WCWP.org, and we will be right back after a short break.
Project Independence is the Aging in Place initiative of the town of North Hempstead. One of the many services we offer is help at home with minor home maintenance. Call 311 or 869-6311 to get more information or receive services.
And welcome back to Project Independence and You here at WCWP.org. We've been speaking with Jennifer Cona, who is chair of the Board of Trustees at the Long Island Alzheimer's and Dementia Center, LIAD. And before break, I know, Otto, you presented an interesting question.
Yeah, well, I had read not long ago that there's a blood test which is not FDA approved, but it's being used in several places for diagnosing Alzheimer's. And I was just wondering what you might know about that.
So I heard about this, and, in my line of work, obviously I gave this some thought, and my thought on this is, let's say you do go get this blood test, and let's say that you now learn that you may or will someday develop Alzheimer's or dementia. What are you going to do with that information? Are you going to comport your life differently? And the true answer, in my opinion, is that most people are not. Perhaps you will get your affairs in order. That is a win-win, because we should all get our affairs in order. We should all do our estate planning. We should all have advanced directives and wills, right? So that is a win. But what else would you really do differently? Okay, I don't think most people would quit their job and move someplace else and live day to day and all those, esoteric things that we all think we should do because, life is short and you could get hit by a bus tomorrow. No one's really going to do that. And there is a lot of downside. So if you have done this test and it says that you are or may develop Alzheimer's or dementia in the future, now you can't get life insurance. Now you can't get long-term care insurance. It's going to be in your medical records. You have just, at whatever age you may be, excluded yourself from all of these things that you very well need or will need medically, and it's going to follow you in your medical chart forever to your detriment. So I don't see upside to doing this at all at this time.
Those are all great points.
And people don't think about that.
No, I didn't, to be honest about it.
People don't think it through. They hear it. It sounds like, oh, I should do this. I should know. I want to know. But people don't take it to the next step. And so my job is to educate people on that. So we did a piece on this on our podcast because I want people to be aware of the negative consequences and not just jump to, oh, I do want to know, and not sit and think it through. And, that is my job. That is my job, is to help people pause and think and make a more informed and more mindful decision about things like that, because they're complicated. Knee-jerk reactions are not good. These are complicated things.
Well, the whole diagnosis process, I believe, for the early stages thing is very complicated. I have a friend who found out that they were showing symptoms, and it turns out they were on Ambien for quite a while. And Ambien has one of the side effects of causing memory problems.
Yep.
People may have a medication issue as opposed to an Alzheimer's issue.
Absolutely. So the Xanax, so a lot of things that people are taking for anxiety or sleep, like you said, medication management, medication contraindications, all of those things are huge. And we see a lot of misdiagnoses, not just in this realm, but with many, many other conditions. And the trouble there is that, unfortunately, we don't have a healthcare system where you have a quarterback. You just have a lot of different doctors, and they never speak to each other. And the pharmacy, not everybody goes to the same pharmacy. You may get some medications from here. You may do mail order for others here. Nobody talks to each other, and it can really derail somebody. And the only time it sometimes can get cleared up is if somebody ends up in the hospital. Then everything does get looked at and can start to get cleaned up. But it should never end up that somebody has to have a crisis situation and end up in the hospital before this kind of stuff is looked at. We really need that kind of quarterbacking healthcare system where somebody says, these are all of the things you're on, and half of this stuff doesn't work with the other half, and that's causing sleep problems, memory problems, depression, anxiety, whatever. And if I take you off this or I change this, it will change your life dramatically. But we don't have that right now, and it is terrible for all people, but especially for seniors.
Just to go further on that point, I agree with you 100%. The next problem is that even if you had a quarterback and you go into a hospital, your quarterback is no longer the one who's in charge.
Of course.
You get assigned a doctor who knows nothing about you.
Absolutely.
Which I don't like at all. You go to a doctor for 30 years, and all of a sudden somebody who met you 2 hours ago is in charge.
Yep.
I don't get that.
But to that point, you need a family member with you at all times, and you need to be your own best advocate, which is easier said than done, because you don't know what state you're going to be in a hospital, but you really have to have an advocate with you, whether that's a child, a spouse, whatever. Somebody really has to be in charge of you and asking the questions and not taking things at face value, and I think especially with our seniors, they see the white coat and the stethoscope and they think that word is gospel. And that's really not necessarily the case. You have to ask questions. You have to, sometimes push back a little bit, and you've got to really be in there all the time as an advocate, and not just sort of saying, oh, they know everything because they're well educated and they have the white coat on. Right. That's not good enough anymore. Maybe it was back in the day, but it's just not anymore.
Well, you have to help manage your health.
Absolutely.
Otherwise, you might as well go to a veterinarian.
Yeah. Yeah.
And don't talk like if you were a horse or a dog.
Right. Only you know your body best. You know your mind best. You have to communicate all that stuff. To your point, the doctor who just met you 2 hours ago doesn't know anything about you except what's written down in your chart, which doesn't really say much of anything about you as a person.
Right.
If
and
they
I think
read
it's
it.
important that seniors find doctors that, there's not a lot of them that are geriatricians that have a practice of a lot of seniors. If you're continuing to go to the same, not that a family practitioner or internists aren't good with seniors, but, as we get older, the issues, the frailty, all the problems that come on, just multiply. And like you were saying, you're like juggling and the chances are, the likelihood is every visit to the doctor, once we do get older, there is going to be some even minor change in dosage of one particular medicine. So it's so important to really find the kind of doctor that, that you're not just comfortable with, but, hears you and, is willing to work with family members and also recommend family members to come with you. So, that's what we need more geriatricians. I mean, the senior population is exploding. 10,000 people a day are turning 65, and that's gonna be for another 9 years. From like 1964 through the whole baby boom generation, there's 10,000 people a day turning 65. So we really need to look at that population that's going to be the majority in just a few years, if it isn't already, and service them the right way, with geriatric medicine, which, if there's anybody listening that's in medical school, that's an important field to kind of come into, because it's going to be a lot of people. I mean, your practices sooner or later, I mean, most practices are going to be 50% people 65 and over.
Absolutely. I will say that some of the medical schools now are incentivizing students to go into geriatrics. So that is a good trend. They see the need, they see the gap, and they are working to close that. And I'd also like to mention that LIA does have a great resource guide of the geriatricians, neurologists, and other doctors that work really well with us and are specialists in these fields, that we give out to people so that they can use that as a guide, meet with them. It's people that know the specific and special needs of not just seniors, but people with Alzheimer's and dementia. And anyone who calls our center, we'll send it out to them.
All right, that's a very valuable list. We may have to get that over here, Christina, right?
Yeah, absolutely. I mean, it's already vetted people, so you don't have to start from scratch.
Right, and on Long Island, so.
Yeah.
Do you see anything starting to open up at all as a result of like all of a sudden you can go to a wedding and you can go to a restaurant and whatever? Do you see being able to visit people's homes or people coming to the center? Is that loosening up at all?
It should happen pretty soon. We were hoping that March 1 would be a target date, but obviously that came and went. So we're working with Nassau County, in constant communication with them. They've been to the center. They know that we're totally COVID compliant. We are waiting for them to authorize all senior centers to reopen. And that would include us as a community center providing the same, similar type services. So as soon as we get the green light, we would open, because we have been, like I said, we're completely COVID compliant. We've done all the deep cleaning. We have the protocols in place. We have new cleaning crews that would do the daily work and the sweeps in between and all that. So we are completely ready. We are just not going to do anything until the county gives us the green light that it is safe. So that's what we're waiting for. And, we've had times when it looked like we could, and then, people started traveling, or then there was Thanksgiving, and then, so it's really been so up and down. And obviously with our population, we can't take any chances as much as we want to. And people are desperate to get back in. And we have a huge waiting list. So we have our participants who were already with us waiting to get back in. And then behind them is a tremendous waiting list for both services in the center and the respite care in the home. Our waiting list is huge.
I'd be curious. I'm sorry. I'd be curious to know how many new people you've had join since the pandemic. And are you able to even branch out in a larger, radius because of the fact that you're.
Yeah. We're reaching people all over the island now. Before we had expanded the footprint when we got to Westbury, as I had mentioned before, but now people can come from anywhere, from the city all the way out to the Hamptons, because of the virtual services. So, like I mentioned, we will absolutely continue that, because we can reach so many more people.
Wonderful.
And our buses go all over. We have pickup points at various assisted livings.
Right.
So we pick up a group of people who want to come in for additional services, and we pick up, people at their homes.
Liad is not a profit-making business, so therefore you have to get money from somewhere. Donations, I would assume.
Yes.
I looked on your website. I actually bought some raffle tickets, your virtual raffle, yesterday.
That is great, Otto. You know what? Let's talk about that. We have to take a quick break.
Did Dan
we're going to be at you'll have 15 more minutes. So we'll be right back with Project Independence and You after this break.
Project Independence is the Aging in Place initiative of the town of North Hempstead. Some of the many services we offer include nursing and social work services. Call 311 or 869-6311 to get more information or receive services.
And welcome back to Project Independence in You. We've been speaking with Jennifer Cona, who is the chair of the Board of Trustees at Long Island Alzheimer's and Dementia Center. I can't believe this is our last 15 minutes with you. It goes by so fast, and there's just so a tremendous amount of information you've provided, and we are grateful. Otto, I know you were I'd kind of cut you off before, so go ahead and continue with your thoughts.
You haven't really cut me off. I've done more than my share of talking here, so.
I didn't want to say that on air.
No, I know. I can't help myself. But, what we were talking about is really that programs like this need to be funded. They're not profit-making businesses, if you will. And all charities right now, it's a rough time for everybody. I mean, if you look at your mail, you'll see that the day doesn't go by where you don't get a few requests for money. And I understand that because programs like yours do great work. How do you try to get around that right now? Like, I know you have some virtual raffles and things like that. How do you, try to keep the funding going?
Yeah. So we are a nonprofit. We're a 501c3. And you're right. These are really difficult times for any nonprofit, any charitable organization. We rely on donations. We rely on program participation, and we rely on state and county funding. So it's challenging right now. And we have some strong lifelong supporters, but we are all, some of them are struggling too. So if they're struggling, we're struggling. We are constantly in need of more donor support. And I will say to anyone, if you value any organization, and if you want to make sure they're still around, whether you support them now or you just, always want to make sure they're there, support them, because they could be gone. Whatever that organization is, they could be gone 6 months from now, 3 months from now, a year from now. It's very difficult times. So we raise money through events, through donor outreach, through stewardship and cultivating donors, and of course we rely on, as I mentioned, the grants from state and county. We have a bunch of events coming up. We have a women's luncheon, which is coming up and going to be held outside in the summer, all socially distant and outside. So that'll be great. We're able to have our golf outing, which is in September, outside. So that's good. As you mentioned, we have a raffle event coming up at the end of March, which is a kickoff for all of these events, to get people sort of thinking about these events and re-engage. We're giving away some really great prizes. That's a fundraiser. Obviously, you buy tickets and get your ticket in the bucket for these really, really wonderful prizes. And all the money goes to our participants. We have a great ratio of very low administrative costs. We have, you can check us out on Charity Navigator to see our rating. We have a 5-star rating. So that your money is going to programming and to participants, not to overhead and staff costs. So that's what our raffle is that's coming up, is to get people sort of re-engaged and emerging from the virtual world and back to the events that we're going to be able to start having, because they'll be outdoors. So we're really, really excited. And in the fall, we're going to be back with our casino night, because by November, we should be presumably back to live events, maybe at a limited capacity, but we should be presumably back on board with our regular fundraiser. So those are our three major things. We have a women's fashion show and luncheon, a great golf event at Sands Point Country Club, and a casino night in November. And I would love to have you guys all come.
Do you have a web?
We'd love to come. What's the best way for our listeners to find out about this? If they want to contribute, or they want to come to the luncheon, or they want to be on a list, what's the best way to connect with LIAD?
All of that is on the website, which is liad.org.
That's easy.
Easy.
LIAD.
Yep.
.org.
Yep.
Okay.
So everything is there, all the dates, all the ways to participate.
Is there a phone number?
Yes, but I don't know it off the top of my head. But anyone can call me. I can give you my phone number, which is.
No, that we can get the phone number. Are you on there, Otto? Are you on liad.org right now?
No, but Christina might be.
Yeah,
Here, I'll look it up. I can look it up on my phone.
Yeah, because a lot of our listeners are, not going to websites. Many are, because we do have a great program actually that we teach seniors about technology, a program called Technology for the Terrified. Mm-hmm. So if anybody's listening and is interested in that, you can call our town's 311 or 869-6311 to get information.
Okay, here's the phone number. It is 516, ready? 516-767-6856.
6856. So that's the general number. If you have any questions for LIAD, you can call 767-5856, or you can check their website at
6856.
6856.
Yep.
767-6856.
Yep.
Right. Okay. And we'll have that number too. You can call 311 as well if you want to get that number. We'll have that available too, or liad.org. So, it would be great for people to be able to, help keep this program going. It's so important.
Yep. And our events are really, really fun, and we always have great prizes.
Well, one other area is that you are Jennifer Cona, Esquire, with Cona Law. So there's you graciously volunteer your time basically for this program, but you also get involved with dementia and the needs really that come up legally. And I could see a long list of reasons. We could have a whole show just on that, but kind of like a top level look at why should people tie in the need for advanced directives and that type of thing if there's any kind of dementia involved in your family, or even if there isn't.
Really? Yeah, absolutely. It's really about the need for planning. You need to plan ahead. And like you said, the need for the advanced directives, the power of attorney, healthcare proxy, living will is so important for everyone, but particularly if there is a diagnosis of Alzheimer's or dementia, because you need to make sure that someone can step up, jump in and handle financial needs for that person, healthcare decision-making, and end-of-life decisions, because you don't want to be in that situation where there's a debate about it, where there's no person to make decisions. If there's a family dispute, you could end up with a guardianship proceeding, which we really want to avoid at all costs. And it's so easy to avoid that if that person can make those decisions for themselves in advance with a living will. And of course, a last will and testament, so that that person can say, here's where I want my assets to go. We really don't want people dying without a will, because then the laws of intestacies, the state laws, say here's where your assets are going to go, and it may not be what you want at all. And we have that happen a lot, which is so unfortunate. And the more important thing too is asset protection planning, protecting assets so that you're not spending it down on the cost of care, which could end up being nursing home care to the tune of $16,000, $17,000 a month. That eats away at a family's savings, and in real short order, you could burn through your money very quickly. You could end up having to sell the family home, all these things where you don't want a family's back up against the wall, where you're making bad decisions, forced to do things you don't want to do. Advanced planning can avoid all that and can leave your loved one not destitute and have that cushion for the things, the extra things, to make them comfortable. It's super important. Or if you need to plan for home care so that you can get adequate care at home and have choices to go to assisted living. That's largely private pay or long-term care insurance. You don't have that choice if you burn through all your money. If you've gone through your money, you end up at a nursing home, even if you don't need that level of care. None of us want to be in that position. So it's all about planning. It is so critical for all of us at any age. We like to say around here, you're never too rich or too poor, too young or too old to plan. Planning, planning, planning. And that's all that we do all day long here at Cona Elder Law. And it's just so important for people to understand that and get the message, and that it's not hard, it's not expensive. We just all need to do it.
If somebody wanted to contact Cona Elder Law, how would they do that?
Our phone number is 631-390-5000. And our website, if people want, is conaelderlaw.com.
And do you do consultations over Zoom, or are people coming to you?
Yeah, they can either come in, or we do them by Zoom or FaceTime or GoToMeeting, whatever people are comfortable with. And right now we're offering free consultations because of COVID, because it's just more important than ever for planning, and we just want to help as many people as possible.
And you don't have to leave the house.
You don't have to leave the house. Nope. We want to keep people safe. Our job is to keep people safe and healthy, and we're just trying to be accessible.
Where are you located?
We're in Melville.
Oh, okay.
Yeah. That's the other great thing about the pandemic is now it's accessible. You could be anywhere. You could be in the city or the Hamptons, just like with Liad, and we can provide services.
Right. There's definitely silver linings along the way that, we're all learning. And I think when things get back to where we can walk around, roam around freely, there's going to be a new normal in every field, in every way.
And it's a positive new normal.
I think so. I think, companies are learning that people can work remotely, and for so many people, it's important, especially if you are a caretaker and, you can be home with a loved one, or, for the children, or whatever that situation is. So I think it's going to be interesting to see what the new normal is going to be.
Absolutely.
There's such a thing as normal, if you think back.
Right.
Yeah. Over history, normal never stays there.
Maybe there is no normal. You're right.
Yeah. The only thing constant, as they say, is change.
Right.
And that's ongoing. Yeah.
The new normal.
The new normal today.
Yeah. Right. So it's been great having you on the show. There's so much information. We always have great guests, and it always goes so fast. So there's only so much we could, possibly cover. And, I'm sure we'll have you back on. And next time, maybe we won't be talking about the pandemic, but really the new way things are done, and with a little bit, like you were saying, with the hybrid scenarios, are a positive thing for seniors too, for everybody. That
would be great. I would look forward to that.
How long have you been chair?
I've been chair for 2 years now.
For 2 years, okay.
Yeah.
So that's your third job, or?
Yeah, that's my third job, between the kids and being the managing partner of the firm. Yep. So I like to be busy. So
we want to thank you so much for coming on and providing such important information. And there's a lot of ways to get the information that Jennifer did provide to us today, by calling, by going to their website. You can always also call 311 to get that information. So again, thank you so much for your time. We are most grateful, Jennifer. And we will be right back with Project Independence and You, and Talk of the Town with Christina Liu.